Right now, I'd like to introduce David Miller. He's with Florida Healthcare Plans, and he'll go over the benefits for Florida Healthcare Plans. Thank you for your time.
Good afternoon, everyone. Yeah, I represent Florida Healthcare Plans, and I can answer questions that you have. And I want to give you a high-level overview of that plan because I know a lot of the employees here consider the HMO version between the two plans, and I want to just kind of show you how you can use that to the best of your advantage. With Florida Healthcare Plans, the network that we have has actually grown about 1,000 providers since last year. I think we were probably at about 2,900 last year. We're at 4,000 now. And I bring that up because the way that an HMO is designed is that by and large, you're using those 4,000 providers for all of your health care. So this is going to be your annual preventive care. This can be testing. This could be hospitalization. This could be surgeries. It's going to be all the things that you need medically. You're going to use Florida Healthcare providers. So keep that in the back of your mind if you decide to use Florida Healthcare because there is a specific network. Now, having said that, we also cover you worldwide for emergency and urgent care, meaning that you could be anywhere. You can be on a cruise or overseas for that matter. And if you get hurt or sick, we are going to cover that emergency exactly at the same cost as if you were here at home and you went to Halifax or Florida Hospital or something like that. So you've got peace of mind of knowing that wherever you are, you've got that coverage. Same with urgent care. If you needed just stitches or something like that, needed antibiotics or things when you're on vacation or out of town, you can get those with the same coverage as at home. So there is exceptions to that network. Another exception might be is if you had a situation where we currently do not have a specialist that can take care of you locally here. Maybe we had a specialist that moved out of the area. Maybe it's a unique situation where we just don't have the best of the best. We're going to actually pull someone in from Orlando, Jacksonville, Tampa, some of these metropolitan areas to make sure that you get the best care. Okay, so there are definitely exceptions to the network. The Workforce Wellness Extended Hour facilities, I know a lot of you grabbed information when you came in, and I've got those hard copies back there. And again, everything that we're covering today is on your intranet. So if you need to print PDFs or get that information, we have it there. And the respective websites, floridablue.com and also Florida Healthcare, FHCP.com, has all of this information as well. But the Workforce Wellness, what we have done is set up Florida Healthcare owned facilities and extended the hours from 7 a.m. to 7 p.m. You're able to get urgent care there. They're all set up to do urgent care. And you have a $10 copay there, reduced copay. So if you went in with a twisted ankle or let's say a sinus infection or you had strep throat or something like that, you can go have that evaluated, treated, have them write a prescription for medication, and you pay $10 for that. So it really is a great added benefit for you. And for obvious reasons, we have that set up so that it's less out of your pocket when you need medical care, because that's a lot less than if you go to urgent care center or, of course, an emergency room. A couple other things there. I mentioned FHCP.com. The My FHCP app is just a really convenient way to do all the things you can do on the website, but you can actually do them on your smartphone. So you download the app, you're able to communicate with your physician, you're able to up your prescriptions or request that if you need it. You can also look up doctors, of course, and things like that. We have the Nurse Advice Hotline, and Florida Blue also has a Nurse Advice Hotline. These are open 24 hours a day. There's no cost to call them, and you have licensed nurses that you're talking to. So let's say you woke up 2 in the morning and you maybe had a bad headache or something and you wanted to find out, is this something that I have to deal with right now? You can get a little bit of feedback on your situation. So it's a nice extra benefit, doesn't cost you anything to use, but it is there for you. I do want to mention the dedicated case management and disease management. The reason being is that, as we all know, unforeseen things happen throughout the year. Somebody's diagnosed with a serious illness or condition. That's a scary thing. And if you don't know how to navigate the health system, that can be a very intimidating thing. But having a case manager assigned to you, you have somebody really on the inside that helps you set appointments, helps you know what to expect in those appointments, help you to know what to expect from the specialist you're seeing. It's just nice to have someone kind of take you by the hand through that process. Again, there's no cost to that. Just call member services and we're sure to get you hooked up with somebody that can help you. There's just a quick map, again, covering the workforce wellness locations. Also, I've added the Seminole and Brevard locations that we've most recently opened, so those are their extended hour urgent care centers as well. Affiliations with hospitals, again, I mentioned the HMO network that we have, but if you need to go to a specialty hospital, let's say Shands, Mayo, Moffitt Cancer Center, any of those specialty hospitals, we have arrangements with them and do business with them on a regular basis. So if you need to go to those, you're sure going to be able to. And of course, you have all of the hospitals in Volusia-Flagler County that are all contracted. So if you decided you wanted to go to Florida Hospital, let's say over Halifax or something like that, you're able to do that because all of the hospitals locally are contracted. The Doctor on Demand, I'll just mention real briefly because I had information in the back there for you on this. Simply put, it is a video visit on your smartphone, $10 copay, and it's 24 hours a day, 7 days a week, and you are talking to and having a Skype session, really, with a board-certified doctor in any state that you happen to be in. So you're at home here in Florida, you're talking to doctors licensed and practicing in Florida, okay? And so they are, there's a multitude of things that they're treating, everything, again, from the simple things, pink eye and ear infection, sinus infection, stuff like that. Strep has been going around lately. I've heard of a number of people who have called in, done a video session, and been able to be treated for strep. They write a script, send it to Walgreens or to the Florida Healthcare Pharmacy, whichever's open, and then you're able to get your prescription. Very, very efficient, and a $10 copay, and you don't have to leave home. So it's really a great benefit. I'll just mention there's also psychologist visits. These are not 24 hours a day. This is something you have to call in. The advantage here is that you get to talk, you can set it up to talk to the same physician each time if you want to do ongoing visits. But for a $30 copay, in some cases that's less than a specialist copay depending on the plan you're on. So as far as the plans, they haven't changed. You know that we have and I'll point out for those of you who are looking at these for the first time, the plan codes, HMO at TS1, S is in Sam. The other one is HMO T51. They're very similar to each other, but I want to make sure just to point that out so you remember when you look at them that they are different. TS1 plan, deductible is $500 for an individual. Simply put, if you have a service that falls under deductible and coinsurance, you pay the first $500 for that service, or whatever the cost is, until you've satisfied the $500. You're going to find that a number of things fall under flat copays, which are not subject to the deductible. The out-of-pocket limit, and this applies to the Florida Blue plans as well, everything that you spend on your health care, doctor copays, medication copays, deductible, things like that, all go into a bucket, and as that bucket gets to the amount of the out-of-pocket maximum, let's say in this case with the TS1 it's $3,500, the carrier covers you from that point to the December 31st of that year at 100%. So if a person had a serious condition and had to go back in the hospital multiple times, your only liability there is $3,500. Everything else is covered at 100%. So that's an easy way to compare plans too, is just kind of look at what is my worst case scenario. And you see the copays are $20 and $35 for doctor and specialist. On the T51, they're $30 and $50. Preventive care is all covered in full for you. So anything that falls under the federal guidelines, the colonoscopies, mammograms, your annual physical, all those things that are preventive care are all covered by the carriers, and that applies to Florida Blue as well. One thing I will point out here is the diagnostic test. You see kind of a range there. It says 0 to 10%, and then it also says or 20% after deductible. The reason I phrased it like that is simply because where you go have diagnostic tests and get those services rendered, really that determines how much it costs you out of pocket. So as an example, if you went over to a freestanding facility like Twin Lakes and had an MRI, it's going to cost maybe $1,100. That would be the real cost. Not going to cost you that because of your insurance, but that's what the real cost would be. Let's say you went to Halifax for that same MRI, you might be looking at $2,700, $2,800 for the exact same thing. So I bring that out because if you go to an IDTF, which is an independent lab or freestanding facility, you pay $0 to 10% with no deductible. So we really are incentivizing folks to use those freestanding facilities. If you do decide to go to the hospital or some of the other facilities, you can do that. It's 20% after deductible. Just keep that in mind. Then your other basic services, outpatient surgeries, hospital stays, ambulance, things like that, all fall under the 20% after deductible. And just to tag on to what Edith said about the ambulance, I did a little research on EVAC here because that's kind of our local ambulance service, and they have about a $425 base rate to pick you up, and then they charge about $8 a mile after that. So I'm just saying that because a $600, $700, $800 bill for an ambulance service is pretty common. So just keep that in mind. Don't be shocked by that. And the nice thing about deductibles on these plans is that they're annual. So if you satisfied your deductible on the ambulance ride, you have no deductible for a hospital stay. You only pay at one time. So just keep that in mind. And this just refers to workforce wellness. Again, you have a $10 reduced copay. Pharmacy benefits have not changed. You still have $3 and $10 for your generic drugs, $30 and $55 for brand name. And again, our specialty medications at Florida Healthcare are capped at $125. So if it was an anti-rejection drug or some cancer agent, you're going to pay $125 for that per dose or per month, however often you take it. But it is capped at that, so you have some insurance there. Or you can use mail order too and get a 93-day supply if that suits you better. Preferred fitness, this is one of the benefits that the college is offering for you, and that is the free gym memberships. And I know a lot of you are probably already using it. We have 65 gyms in the network now. You can go to any of these gyms as much as you like for free. All you do is take your Florida Healthcare member card, and you go in and use that as an ID to get into the gyms. You don't have to pick a particular gym. There's no contracts. There's no commitment to any gym. You could go to the YMCA on Monday, and if you decided on Wednesday you wanted to go to Planet Fitness, that's totally fine. That's the way the system is designed. You can go to any gym as often as you like, no limit, and we encourage you to do that. So that benefit is there for you too. And we did mention the nurse hotline, and both Florida Blue and Florida Healthcare have those, so feel free to use that.